Welcome back, everyone. U.S. health officials are issuing a sharp warning following the dramatic increase in STDs, and they are asking the federal government for help. Meredith Wood has more on what's behind these numbers.
For the fifth year in a row, rates of syphilis, gonorrhea, and chlamydia have gone up in the U.S., according to the U.S. Centers for Disease Control and Prevention. About 2.4 million new cases of these STDs were reported in the U.S. in 2018, reaching an all-time high. Alaska, Mississippi, and Nevada had the highest reported rates of chlamydia, gonorrhea, and syphilis, respectively. But Washington, D.C. reported the highest rate of all three diseases. All three of these diseases are treatable. But if left untreated, they can cause problems with the prostate and testicles. And women could suffer damage in the reproductive system. If a pregnant woman has syphilis and leaves it untreated, they pass it to the baby through their placenta, which could be life-threatening to the infant. The D.C. Department of Health says the rise in cases could be that screenings are more readily available, leading to more people getting tested. However, according to the CDC, the use of condoms is on the decline. Experts are focusing on education as the best method towards prevention, as well as utilizing testing and available treatment services.
Dr. Stephanie Baer is an infectious disease physician at the Medical College of Georgia at Augusta University. She is also the chief of infection control and epidemiology at the Charlie Norwood Veterans Affairs Medical Center. Dr. Baer, thank you for making time to come and talk with us today.
Yes, ma'am. Thank you.
Sounds like you are very busy. I know that you can talk to us about the overall rise in STDs. One thing that was interesting in the story we just saw, they feel like that the rise could be attributed to a decline in the use of condoms, or it could be attributed to more people getting tested and then skewing, just more numbers to rise it. What are your thoughts about this rise in sexually transmitted diseases?
Well, I think one of the leading theories is that so much in the 90s, people were afraid of HIV.
Right.
And with the advent of treatments for HIV, now it is a chronic disease and very easily controlled. And so I think there's a lot less fear about STDs, that they're more treatable, more controllable. And so with less fear, there's less precaution being taken.
Yeah.
And I think people are taking more risks with their intimate behavior.
HIV and AIDS was at one time a death sentence.
It was.
And now you're saying it's a chronic disease. It's something people live with.
Absolutely.
They're treated for it, but they live with it.
That's right.
And so that could account for just the more reckless and not as careful about using condoms and things like that. One thing that we hear about also is that STDs are increasing among senior citizens, and it makes you think about like nursing homes. Is that really something that you see, or is it that more seniors are sexually active and they've had one partner maybe for so many years? Or what do you think about that?
Well, what I see in my practice is a common misconception that people believe their doctors are testing them all the time. They believe these tests are being run routinely. And what people don't understand, if your doctor doesn't know that you have a risk factor, or if you don't ask to be tested, those tests aren't always routine. And it's such a tragedy because there are people coming to see infection providers like myself who have been probably infected for a long time and were just never tested. And so it's important for all adults to get tested at least once in their lifetime. And if they know that they're taking risks or may have had a sexual partner and not had protection, then it is important to tell your doctor what's going on in your life and be sure that you're getting the testing you need. It's routine that doctors screen for diabetes, for cholesterol, for blood pressure, but sometimes the sexually transmitted infections don't come to mind, or they're not on the list of things the doctor does routinely. So just be honest with your doctor and be sure you're getting tested, because the great news is they're very treatable.
Your specific study shows an increase in syphilis among people with kidney failure. And how do you see that correlation?
So I don't think it's definitely related to the kidney failure itself. I think we're seeing a rise in syphilis in the general population like we just saw. And I think the people with end-stage renal disease or also part of that population, and they're seeing a rise in syphilis as well. Even though they're more chronically ill, they may not have been tested since they were in their teens. And so syphilis is an infection that can occur at any time in life and then will persist.
And it causes brain damage, right?
It can. So primary syphilis often is a painless ulcer and goes away in about 3 weeks. Secondary syphilis is often a generalized rash and can be more complicated than that, can cause brain and eye problems. But most of the time, it can be a mild rash and it goes away in a few weeks, and then you enter the latent phase, which can last for decades. And about 30% of people with syphilis, if untreated, will progress to some very serious sequential events such as strokes, vascular disease. It can be very serious. And so completely preventable with penicillin if it's tested for and diagnosed.
And that's one of the things that you are recommending, you and your co-author of the study, recommending that physicians ask if their patients, their sexually active patients, are at risk. That conversation needs to happen because it is treatable.
Even though it's an uncomfortable conversation at times, it's important to go ahead and ask and do the testing as it's needed.
Do you think that this is an area where maybe parents of young single adults need to step in and could we make a difference if we have a conversation with our young adults?
Absolutely. I think anything that would raise education and raise awareness and maybe make people be a little bit more careful or get tested as needed, as often as needed, would help.
All right. Dr. Baer, thank you so much for talking to us today. And it's a troubling trend, but we're glad that there are folks like you who are doing the research behind it. Up next on Jenny,
an elegant evening of sophisticated fun in a tribute to 6 decades of James Bond. Details of the upcoming Augusta Symphony Gala featuring the music of Bond after the break.